You're watching Louisiana First News this morning at 8.
All right, welcome back. We're in the middle of Breast Cancer Awareness Month, and cancer treatment can lead to a lot of changes for women, including when it comes to their hair. Here to tell us more about scalp care during and after cancer treatment is Yatana Terode, and welcome back.
Thank you. It's a pleasure to be here as always. Louisiana First News, and Ashley, thank you so much. So as we are now we've entered into breast cancer awareness, and most people are going through cancer treatment, radiation, chemotherapy. They're experiencing fatigue, body changes. But one of the things that I noticed first off, and they notice, is hair loss. So when it comes to hair loss, and most times they don't know what to expect. So depending on the type of treatment, whether it's chemotherapy or radiation, chemotherapy, most people are going to lose their hair, okay? When it's radiation, it depends on the treatment, how it's targeted. So some people may or may not lose hair, or if they do, it's in certain areas, depending on the type of cancer treatment. Now, when it comes to the beginning of cancer treatment, it's best to kind of, get comfortable with it. So in case, you do lose the hair, what to expect. Making sure you show the person maybe who's styling your hair what type of hairstyles you're accustomed to. So in case you may need a cranial prosthesis, which is a medical term, for a wig, and there are different types of wigs. Also, scalp care is key. Okay.
And now tell us about the importance of scalp care with wearing the wigs, because I know, like, sometimes for me, I was saying, you try to keep your hair clean, wash it regularly, but especially with being fatigued after, suffering from cancer, how does all of that tie in together? Okay, so fatigue, but also for scalp care, sometimes the scalp may be a little more dry going through treatment. Okay, so when you're using a shampoo, make sure you're using a sulfate-free shampoo. Also something that's, I notice cancer patients also fragrance is tolerant. They're not tolerant to high fragrance. So something with low fragrance or no fragrance at all, something that's going to be very gentle on the scalp. So it's pretty much, if a person is bald, it's pretty much like taking care of their face. Okay.
Using gentle products on the scalp. And then also too, I have these. These are little facial sponges. Once water hits it, it can turn to this. This is a way they want to exfoliate their scalp without causing any damage. Also, when you're dealing with your scalp, one of the key things is use your cushions.
Okay.
Don't use your nail beds, because that can cause you. Remember, your body is changing, so you're going to be a little more sensitive or prone to infections and other things going on. So you're going to be very cautious. Use your fingertips, or you can also use a tool like this, with a scalp massage, and you can go gently across the scalp with this.
Now, quick question for those who may be suffering some type of pain after the treatment too. Is there some type of way, like a very gentle way they can do it themselves, or since this is still new to me, just learning how to tie in scalp care with those who are suffering from cancer, something that's offered at different hospitals or special treatment centers?
Absolutely.
It's for them to do it for the person if they just can't.
Yeah, if they can't, like, let's just say, for instance, someone right now, I know when people are going through cancer treatment, finances, there may be issues with finances. However, there are certain support groups. There are your American Cancer Society, your cancer services, and with the American Cancer Society, some areas still do the Look Good, Feel Better program. It's depending on the facility. And there are programs that can help with the care tools, as far as your products, your beauty. Because some people may need makeup, as far as caring for the nails, caring for the scalp. But here's the thing, and helpful tips at home. When it's caring for the scalp, something satin or silk.
Yeah.
So if you
keep
don't,
the moisture.
Yes, and that's not just for a cancer patient, right? So satin or silk. And here's the thing, we have different types of wigs, and also when you're selecting your medical wigs or your cranial prosthesis, you want to make sure that if you're not wearing anything as a protected, it's also something soft on your skin or your scalp. Because friction, any little damage as a cancer patient, any changes in their body can totally affect and cause some type of other infection.
More irritation.
Yeah, irritation, right, or redness. And then I also have here, which is it's a wig cap. So with this wig cap in particular, if we have a person who has hair loss, the satin still touches the hair.
Okay, and still just helping to lock in that moisture, prevent that irritation.
Right, so that way, as they're caring for their scalp, they're using a sulfate-free shampoo. They're also making sure they're using some type of oil or some type of, and this is our oil treatment here that we have, but using some type of oil or moisturizer that's lightweight, so that way they can massage the scalp. Now, when it comes to wearing the wigs, you want to make sure that you also are protecting your scalp at all costs. So that way the satin or silk helps to hold the moisture in the hair. It's lightweight. Also too, irritation. Cancer patients, sometimes they don't want anything on their head. But if they do, there are also alternatives to look and feel good. Here we just have a regular piece of fabric, lightweight.
Just put on a nice cute scarf and just go out, dress it up with your...
Yeah, so here's what I noticed. Even if those that want to be discreet, there's the little bags you can just throw your wig in, be discreet, and be on the go, right? Okay, so when it comes to fashion, okay, even though you may not look good, you may not always feel your best, and you're going through changes in your body, right? But you still want to look good. So here, this is just a normal piece of fabric. But here's the trick, Ashley. So what I find is people are going through cancer treatment, their head shape may be a little smaller.
Yeah.
Okay? So we all have shoulder pads laying around. Yeah. So if you look here, this on this mannequin with the scarf, there's a shoulder pad right here.
Just help fill it out a bit.
Okay, just to fill it out. So what you're doing is, what we did was, you just take the shoulder pad, put it right here, and you could put your fabric, your scarf, or whatever you're putting on, even hat. And then nowadays, there are custom pieces where there are partial hair pieces that you can add. So if you don't want to wear the full wig, you want to wear a hat or something, there are partial hair pieces that a person can add. But ultimately, for healthy hair and scalp care, undergoing that cancer treatment, just notice that sometimes you're going through treatment, it could be 2 to maybe 4 weeks later that you'll notice that hair is coming out. And typically after the cancer treatment is going on, it could be 3 to 6 months when the hair starts to return. And everyone's different. And then I've noticed too that there are people who have the chemo curls. I don't know if you've ever heard that, where
I think so.
Yeah, like as the people, like some cancer patients are going through cancer treatment and the hair returns. It could return gray depending on the pigmentation. It can also return back as a different texture or even a curlier pattern.
Well, I want to hear more of this information, but I may have to bring you back again next week because we have so much more to share, but unfortunately, we're at the end of our time. But we will have all this information about how you or a loved one can still take care of your scalp well, even after dealing with post-cancer treatment. This information will be on the Louisiana First News website, but we'll have to bring back our Louisiana trichologist again for more tips.